going to go on. We're going to have an awesome meeting today. We have some really interesting data that we're going to present. Before we get started, I want to welcome you and just let you know we're going to go through this. This is going to be another data review that is going to go in depth, but it's going to be interesting because we have some other things that are going to take place as far as demographic surveys and whatnot. But I want you to please, if you're online, sign in, make sure you check your chat box, make sure you're signed in. If you need interpretation, make sure you check the globe at the bottom. If you are in need of interpretation here, we have, for those that are present, if you're in need of interpretation, we have the interpreters that are here. You can go ahead and put on the devices that will translate for you. So before I go any further, I'm going to turn this over to Carmen so she can say exactly that. Go for it, Carmen.
Sí, buenos días a todos y bienvenidos a la reunión el día de hoy. Si desean escuchar esta reunión en español y están en su computadora o su laptop, abajito en su tablero van a mirar un símbolo de un mundo. En ese mundo van a poder elegir el idioma de su preferencia, que sería el español. Si están en un teléfono celular o una tableta, van a mirar 3 puntitos que dicen More o Más, y ahí van a poder elegir el idioma de su preferencia, que sería el español. Gracias.
Okay, so our agenda for today, we're going to have an icebreaker, and then we're going to go through our meeting agreements and our demographic. What we have special is our demographic data collection and our timeline, and then we're going to do our data sense making, where we break into our designated breakout rooms online and here, and then our closing remarks. So last week or week before last, we reviewed the environment data. We talked about the effects of the environment here in the Antelope Valley and our regions. We came up with some awesome suggestions. In fact, some things that are going to produce some projects for us as a team of residents. We reviewed the 6 conditions of change and how they are affected, or the 6 conditions of change, how it can affect the environment, how we can implement that. And then we reviewed the desired results. So as we move on in our agenda, I'm going to introduce our newest member to our Best Start team. His name is Omar Gonzalez, and he is our community organizer, correct? And so we want to welcome Omar. Omar, come on. He is going to do our icebreaker for us this morning. Omar, you're welcome.
Hello, everybody. My name is Omar. I will be the new community organizer, as Darrell mentioned. A little background about me. I studied at the University of Riverside, California. I got my bachelor's in anthropology. I have a strong background working with Latino men in an organization called Hermanos Unidos. Our mission was to go ahead and reinvent these traditional ways of what it is to be a Latino man, being able to get our gentlemen into college, through college, and out of college, because Latino men actually have some of the lowest retention and graduation rates out of other ethnicities. Yeah, that's pretty much it about me. I enjoy cooking and watching movies with my wife.
Awesome. Now our icebreaker.
Sure. So today's icebreaker will be what helps you de-stress. For me, I enjoy cooking. I enjoy working out, going out and visiting different locations, hiking with my wife, watching different movies, and yeah. I'd like to open it up to anybody else.
Oh. Maylene and okay. Translation.
I don't think it's on.
What helps me de-stress is music. I like to listen to usually smooth jazz.
Oh,
I like to either walk through the mall or shopping center or whatever and just kind of people watch and think of new ideas of stuff I want to put together, projects. I do a lot of mental projects in my head. Sometimes I never get around to it, but it's enjoyable to kind of figure out, all the little parts and things you need to put together, either in Michael's, because it's like Disneyland for adults, and or Hobby Lobby or something like that. Those are my runaway places. Hello, good morning, everyone. My thing that distressed me is cooking and listening to music while cooking.
To distress, I like everybody said, music, but I also like getting outside, going to the park, going to the beach, anywhere where I can just get out into nature really helps me to distress, so.
Is there anyone online?
Yes.
Okay, we do have one.
Oh.
Sylvia did mention she likes crafting, game nights with family. Monica also mentioned she likes
Thank you, everyone. I didn't get a chance to say mine. However, it was already said. I love listening to music and dancing. I just dance through the house and, that distresses me and probably stresses out my husband, but it distresses me anyway. So we're going to continue on. We're going to review our meeting agreements. So in the center of each table, we have our meeting agreements. I would love for someone to volunteer and read those for us, or go ahead. Yes. Thank you, Kari.
okay, the first one is be punctual, stay present and engaged and on topic, put the focus on the future, be authentic, be yourself, one person speaks at a time, agree to disagree respectfully, finish your sentence, not your paragraph, step up, step back, exercise confidentiality when necessary, be patient and open to the technology, keep your video on if possible, assume positive intentions, separate person from the role, and be creative and have fun.
Awesome. Thank you so much. Can I get a thumbs up? Everybody agree with that online and in person? We've got thumbs up. Okay, cool beans. So we're going to do something really unique this morning. Sylvia is with us. She's just online with us. And Bridget is with us, but she's online with us. So for those of you who are present here, you're going to hear them. We're going to go through the slides, and Bridget is going to do the introduction for the demographic data collection. And we have our awesome ladies that are here that are going to help us with that. But I'm going to turn this over to Bridget right now, and then she's going to introduce our resident presenters. Bridget?
Thank you, Darrell. Welcome, everyone. Good morning. Thank you for being with us today, making some time. So we're going to be introducing today the demographic data collection. So today, part of our learning and evaluation work involves capturing a snapshot of the makeup of our regional partnership. So to do this, we will be asking you today to complete a brief survey that asks you some demographic questions or that describe who you are. This is completely voluntary, and to tell us about why this information will be important for a regional partnership, we have three wonderful ladies that are going to be sharing with you, who are Diana, Denise, and Kelly. So we can have Diana to the next slide. please.
Come closer.
Closer to that, Mike.
Yeah, come a little closer to this mic, and then when you come, Denise, come over here, okay?
Can they hear me now?
And I hear you now, pop up.
Can you hear me now? Okay. So I'm telling you why the data, the collection, the demographic data is important. Number one, it describes who is part of the regional partnership. Number two, it helps us access if we are meeting our short-term, medium-term outcomes. It helps us design the regional meetings. It'll help us track change over time. It'll help us identify the needs and strengths in our community. And it will help us tell the story of our regional partnerships. Next person.
Thank you.
Thank you.
Thank you.
No, that's Kelly's. You skipped one. Oh, okay, here we go.
There it is.
All right. How will we use this information? The survey is anonymous and participation is voluntary, but we do encourage everyone to participate in the survey. We're going to use this information to report to First 5 LA via an infograph or summary report. Now, I'm the type of person that infograph, I wanted to make sure that I understood the word. So it is a graph of the information that they will put together. Inform the learning and evaluation of the regional partnership by tracking short-term and medium-term outcomes. So this way we can look at what we're doing and what effect it is having in our community. And that's very important for us.
In the survey, it would also, what types of questions are we asking? The survey is anonymous and participation is voluntary, but we encourage everyone to complete the survey. Different information that will be asked in the survey will be race and ethnicity, primary language, zip code, gender, highest level of education, attainment, number of children, adults, and other adults in the home, employment status, participation in other programs, community groups, access to public benefits.
Okay, so we're going to be collecting now collecting the survey, sorry. So just to let you guys know, if you didn't already hear from all the ladies, once again, the survey is anonymous and participation is voluntary, but we encourage everyone to complete the survey. There are two options. So one is a paper survey in person. You have an English and Spanish version. And then virtually, we have the QR code that you could also use in person if you feel comfortable utilizing the QR code to complete the survey. So we want to remind you that you will only take one version of the survey. You don't need to do it online and in paper. One is sufficient. I will be providing the link if that's an easier way for you to take the survey as well. I will provide it in English and Spanish shortly. And please remember to submit, click submit once you are once you complete the survey online. Okay, does anyone have any questions? And while you're taking the survey, if you guys have any questions, whether in person or online, feel free to ask any of us. And we will be happy to help you guys.
So let me interject right here. If you're here and you would prefer to take it online, you can do the scanning of the QR code. And we also have it pulled up on our iPads. So you can go ahead and do it directly. But if you prefer a hard copy and you just want to do it, we have those available as well. So if you would prefer a hard copy, just raise your hand and I'll pass those out to you. But if you prefer, you can scan the QR code and take the survey online, or you could do it on one of our iPads. Stephanie has her iPad available for those, and so does Flora and Maylene. So we have our staff here that have pulled up the surveys. You could take it online. But if you want a hard copy in English, raise your hand. If you would prefer a hard copy in English. Okay. If you would prefer a hard copy in Spanish, you can raise your hand. Okay. Did everyone? Okay. I know that Omar passed them out in Spanish. Is there anyone that needs one in English? All right. So go ahead and take a few minutes. We're going to give you a few minutes to fill those out. Yeah. Online as well. Take a few minutes. We're going to give you a couple of minutes to fill those out for us. And then we're going to continue on. Yes. Yes. You could please do that for us right now. We're going to take a few minutes for that. And thank you for our resident leaders that took participation and took steps forward. You appreciate it. Thank you so much. Yeah. I feel like I ought to be singing the Jeopardy song. Dun, 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 dun. So as we're filling those out, we are capturing all of this information. So if you finish, go grab you something to eat or drink, and then we're going to get started in the next minute or so, and we'll collect those. Thank you. Go ahead, the collected ones. Make sure she fills out.
Anyone have any questions?
Please
Virtually by
fill
virtual?
out both sides. Make sure you don't skip an answer. We do need the completed survey taken. So when you do it, please make sure you fill out all the questions. As you finish those, we're going to go ahead and move into our next segment, our data, mats, and our timeline. And I'm going to turn this over to Sylvia right now. I know Sylvia, can you hear me?
Yes, I can, Darrell. Thank you. Can we go to the next slide, please?
Yeah. Go ahead, Sylvia.
Thank you all so much for participating in the survey, coming to this meeting today. And I can't even believe where we're at. We've done so much work. You've done so much work since we started doing all the data mats. And, you know, we're really looking at what are some of our next steps are going to be. Because I don't know if you realize this is our last data mat that we're going to be looking at. We've gone through quite a few meetings where we're analyzing this, but we're really going to take all the data, all the feedback that we got from you. We're going to create what we want to do is we want to have in July what we call, it'll probably be in the second meeting of July or the first meeting in August, where we're going to do the data journey and really just kind of take a look at everywhere that we've been and how far we've come. But then it's also going to turn into putting it in your hands in terms of the Best Start community. We're going to be able to then take a look at that and realize, hey, where do we want to go from here? What all these areas that we've looked at in the data are so important, and it's going to be really difficult to decide which two are going to be the most important because we all have different priorities. But part of Best Start is that we really need to have two priorities to move forward. And so that's going to be the real tough work is when we decide what we want to do. Because once we decide what our priority is going to be, at that point, we're going to then start focusing on creating our committees. And then from the committees really is where we start working on what community projects we want to do and where you want to guide our priority and how we're going to make that happen. So for July and August, we really are really going to have to like take a look at everything. We will be sharing all the data mats again with everybody. So you have an opportunity to really take a look at that and really just kind of give yourself a reminder of where we've been. Can we go to the next slide? So like I said, I can't even believe we're here. You know, we've done all these data mats. Today's our last one, but really, I think that all of us, not just the Best Start team, but Best Start members and Best Start community, I feel like this has been such an educational part to the work that we're doing. And I've heard from other people who are not necessarily part of Best Start or other organizations who feel like the data that we've provided, all the information that we've given, it's really valuable, and I think it's something that we're going to keep working on. And like I said, so our next step on our agenda prioritization is really then taking a look at it and voting on where we want to go. But I'm really excited and I'm so proud of the work that you all have done to get us to this point. Next slide. So as I said, our last slide for today is health and mental health. And I will hand it off to Bridget to set the context for us.
Hello. Okay, so today we will be spending most of our time reviewing and making sense of data related to health. Before we do this, we want to frame and ground our conversation. We want to focus on systems and conditions, not on blaming communities. We want to focus on reflection and learning. And we want to uplift your lived experiences to add additional meaning to the data. Now for our breakout sessions, we will be working in small groups to review data and health related to the AV. In Zoom and in person, you will be placed in small groups. You will work with the facilitator who will review data with you and guide the small group conversation. The data that you will review are from the most recent public data sources available. While conditions in communities may have shifted, data for 2023 are not yet available to reflect the most current trends. However, this data still serves as a starting point to highlight the issues impacting communities. The focus when reviewing these data mats should be on the issues and not necessarily whether or not the data is right or wrong. As we review the data, we will ask you to reflect on the following questions. What do you notice in this data? What stood out to you? What surprised you? What systems or conditions play a role in this issue? And after working in small groups, you will be returning to the large group and have a brief share out. All right, so we can go ahead and be placed in our groups.
Hey, so in person, I want to address, because of how the room is laid out, we want to make sure we have equal amount in each group. So if we can get maybe 2 people to add here, because Pilar's not participating, she's with Flora. So if I could get like 2 more people for this group to address that side, and we'll have group in the back, that would be awesome. We just want to make sure it's evened up. I don't know. Yeah, either move your chair or just grab a chair on this side. If we have like, yeah, just come on over. Can I get like 1 or 2 more people for this table? Yeah. Come on together. Let's get this party started. All right. And then Flora and Maylene are going to be with one group. Omar and I will be dealing with the other group. So get comfortable. We're going to grab your data sheets and we're going to go through this information together.
Stephanie? Stephanie? Or Darrell?
Yeah, once they get started, they can't hear us.
I
Is
can't pull up any of the stuff.
Hello.
You didn't get a room?
no, she said
No, she's in the main room for the Spanish speakers, so they did the interpretation.
Okay, because I can't pull up the Jamboards. We're gonna have to just do it all in one room stuff.
Oh, okay. So I'll just leave you guys all in this room.
so
Yeah,
it's
please.
ready to go.
Okay, let me close the room.
Yeah, okay, thanks.
No problem.
I can't pull up the data mats. That's what's happening on my computer.
Okay, there's still 4 people in the room.
Yeah, she's bringing them over.
Okay.
There we go.
Are they all back?
I apologize, everybody. We had to bring you back into this room. My computer is not letting me bring up the data mats, and that's clearly our most important part. So I'm sorry. Go ahead, Bridget.
Able to work. Some of those factors definitely, it's because we don't get necessarily rural differential. I know some agencies get creative, but it definitely has to do with reimbursement, and it's not the educational attainment. It just overall, I think the system overall just go across the nation, or at least in the state of California, is experiencing a lack of mental health providers.
Yes. I want to add to what Olga was saying. I was in an event on Saturday and I met the.
Yeah. Hi, everyone. This was so intense. Great conversations in the room. I know you all had great conversations online. So what we're going to do is have our time of feedback. Let's talk about what are some of the things that stood out that came to Go to the next slide. Let's go to the next slide. What reflections as we're going through, and I want to hear from both online and in the room, the discussions. So where, do we have the microphone in at the tables? Okay. Let's get, okay, so let's go around. Let's start with group one. Let's get some of your reflections. What were some of the things that stood out to you from this data? What systems do you think are in place from this data? And I want to hear some of the conversations that took place. Go ahead. Any? Come on.
¿Hay algo en particular que usted escuchó que le sorprendió? La mayoría, todo. Pues la mayoría, todo, porque es lo que yo nunca había asistido a estas juntas, hasta ahora hace como medio año que he estado en estas juntas.
Everything surprised me. I mean, I really haven't been to any of this type of meeting in 6 months, but all the information is very surprising.
Okay.
These are some of the bullet points that we had, and we had a lively discussion.
All right.
We were talking about, need more ways to advocate in, information for the healthcare, like how a lot of people may have Medi-Cal or Medicare and don't realize they don't just have to go to these little mobile clinics or the little offices. They can go to the bigger doctor's offices, because a lot of them who have, PPO or HMO, they do accept small numbers, but they do accept some Medicare and Medi-Cal. Just the community just doesn't know it, so that they can get better services. Living conditions affect their physical health. If our numbers were really high, we really just believe it's the air quality, the conditions in the community, not necessarily about crime or anything like that. It's just, we have a lot of things going on in the air that are causing respiratory problems, cancers, things like that, that are bigger than LA and some of the other places due to the environment. The bad stigma towards pregnancy, needing more support for moms. Sometimes it's not that the mom is not happy she's having a baby, it's her circumstances as to why she's having a baby. Where she may not go to the doctor so she's 8, 9 months pregnant, or because of stress, financial issues or whatever, so the pregnancy is not celebrated to where they don't get the resources that they need because they just feel like, I'm really not happy about my situation, as to why they don't go to the doctor. More advocacy for mobile clinics. 20, 30 years ago, they had them everywhere. Now people, they don't have them anymore. So sometimes they don't have access to get to the doctor. They need someone to bring it to them. And I really think we need to go back to that program. Lack of transportation. One of the biggest things out here. There's not a grocery store. We cannot walk to the store. We got country blocks out here and it's too hot in the summertime and we just don't have the access that we need. I got a car and I still got to drive 10 or 15 minutes to go to the grocery store. Could you imagine needing 8 or 9 bags of groceries, walking or having to get on the bus? It's just not gonna happen. Lack of mental health services. Sometimes people need someone to come to them. It could be, we gotta take the mental health people like Jehovah's Witness, walk around knocking on the door, say, hello, do you need a hug today? Can I talk to you? It's just about setting a standard of talking to people, sitting down, having a conversation at your Primos, at your, Jack in the Box, things like that, having little table conversations with people. All the information we have here, we can take it back to our own community and talk about everything that we talked here. Because sometimes people just don't want to be in this setting, but they want the information. More nutritional workshop. That was one of the last things we just talked about. Lack of healthy food, but we don't have access to the food. We don't know how to cook it. I didn't know what jackfruit was. I didn't know what satine was, a certain kind of meat and all these cheeses and different things like that. And let alone how to cook it to where it tastes good. So if we had more information, how to cook it, make it taste good, I might be more apt to try it rather than me walking by it. I see it and then why does it cost so much? That's a factor right there. And I can pay for it. I just don't want to if I can choose a cheaper option. I want something else. So lack of education, we all need the resources. And we were told you guys had cooking classes in Palmdale. We need more information about that. I'm showing up at the next one. But then also my sister right here brought up a factor of the allergies. There's so many allergies. My granddaughter has a shellfish allergy. My niece has a peanut allergy, but she didn't develop it. She was 30 years old. So sometimes we don't know the nutritional information. We don't know if we're allergic to something. So a lot of us need to be tested for all the different allergies to find out what we're allergic to instead of us having a uh-oh and we run into the ER. To know we can't eat that kind of food. So that's what we talked about.
Okay. All right. Thank you. All right. What about my group two? Who's going to talk out for us? What- Go ahead, Denise. Go ahead.
Okay, so things that we noticed was employment and population conditions play a role in it, because if people don't have the right foods, they're not gonna eat healthy, and that's gonna affect their health physically and mentally. Childhood and adult obesity is an all-time high, which that goes back, again, we were talking about education. It's important to educate, it's important to give people what the information they need as far as their health, their physical and mental, like this young lady was talking about. Cooking food and knowing how to cook it so our children will eat it, and not always giving them sugar and fast foods and the things that aren't healthy for them, the things that are quick and convenient. So, the cooking classes and knowing what to do and knowing how to prepare healthy meals on a budget. That's really, really important. So that's part of that education. Almost 40% of the people don't go to doctors. And we have figured out that that has a lot to do with the medical community as well. We just don't have enough doctors up here. We don't have an incentive to get good doctors to this area. And then also sometimes transportation to getting to those doctors and getting appointments, because oftentimes it takes a long time to get those appointments. Black babies in LA County die at 3 times the rate of white or Asian babies. And we were looking at just the care, the difference in the care and getting to the doctors and being able to get care in the first 3 months. A lot of the African-American women aren't able to get care until like the 2nd trimester. And that goes back to their, again, economy. A lot of them have Medi-Cal and things like that. So they're put kind of down towards the bottom of the list as opposed to the top of the list. Lack of mental health therapists, school counselors in the Antelope Valley. And we had determined, and this was one of the things that I had talked about, is our mental health. And a lot of people don't realize this. Our mental health relates to our physical health and the other. If our physical health is not good, it affects our mental health. And that tends to add to the depression, the mental health issues, the rates of suicide, and all of that. So if we start with the physical health, it will improve the mental health as well. So that goes back to the education system, affordable health and foods, and also activities for families. Things that families can do to get together, to be physical together. We spend way too much time on our cell phones and in front of TVs. And every kid has a cell phone these days that they're playing on half of the time. And I remember when I was little, we used to go outside and play tag. You used to play hide and seek and all those types of things. So I really think that goes back also to training the parents. The parents have to be physically active. The parents have to be an example to their children of what to eat. So that all goes back to education. But we also figured out that in this area, there's a lack of access to fresh foods, funds to get the fresh fruits and vegetables. And as I said before, doctors. And that all pretty much relates back to the same systems. We need to improve our health systems, mental and physical, our educational system, and even training with doctors. We were talking about how there's certain things that African-American women tend to have to deal with during pregnancy, and the doctors just don't test for it or just don't pay attention to it. So that goes back to educating our doctors in medical school that they should watch for certain things and test for certain things if a woman is having issues in pregnancy. So that was it.
Awesome. Thank you, Denise. Do we have a share out online? What about our breakout groups from online? Raise your hand if you would like to share online. Raise your hand. Don't be shy. It's just us. Anything that stood out or resonated that you'd like to share? Just raise your hand or type it in the chat and Stephanie could read it to us.
I would like to nominate Olga, and not just to throw you out there, Olga, but you have so much information and you're our expert. So I really want to share your knowledge with everybody in the room as well.
Thank you. Thank you, Monica, for that opportunity. Hi to everybody. Nice to see you all virtual. I'm Olga Viktorchik. I'm a health program analyst, education sector liaison with LA County Department of Public Health. And I've been privileged to be a part of this group for a long time. And it was interesting. The survey was asking, how long have you been engaged with Best Start efforts? I'm like, I think since day one, I started with public health back in 2004 with first 5 LAs. So, and Antelope Valley region has always been near and dear to me. So seeing these data definitely still rings an alarm, because there is a lot of work to be done. We talked about how COVID had impacted a lot of the health outcomes and some of the numbers we are seeing in terms of, for example, mental health and, and suicides and whatnot, in access to the healthcare system. We talked about the lack of access to specialists that the other groups already covered. We talked about the perinatal health outcomes. And I also wanted to mention that we are doing some great work in Antelope Valley. So it's not all doom and gloom, right? There's already some great efforts happening, and we just need to continue moving in that direction. I wanted to highlight the work of the Antelope Valley African American Infant and Maternal Mortality Prevention Initiative. And some of the data that we had discussed also, I wanted to know that it is coming from, though they are coming from some older sources. So, some of the 2016 data, while they can inform us of what historically has been happening in Antelope Valley, I think we need to also consider some of the newer trends, because for, like health insurance coverage or maternal health outcomes, we know that a lot of work has already been done in Antelope Valley. And I want to congratulate this group on being so active and, working so consistently for the past several months to identify the top issues that we are facing in our Antelope Valley community, and being so consistent in figuring out the solutions and the next steps. So thank you. Anyone else from my group, please add. I just gave a big picture and a little bit more of a context, but please share any more of the specifics that we had discussed. Thank you.
Thank you, Olga. Anyone else would like to share? Okay. All right, great. So I want to make sure that what you take away, what you shared today, you need to understand that we are capturing your thoughts, because we're going to be moving according to what you say, what's important. That's why we capture this and what stands out to you. I know we have a Survey Monkey in the link for you to take, but before we close out, I want to invite our first 5 LA representative, Pilar, to come and say a few words. She's been kind of circling here with us today. She drove all the way from Los Angeles up here. She loves the Antelope Valley. She's gonna move up here. I'm telling her, she's moving up here because she's always up here. She's always hanging with us. So, and we love Pilar. Pilar, come on up for a second. I want you to go ahead and share some things that, no, this is on, so you can go ahead, come on and share.
Good morning, everyone. Thank you for letting me crash your meeting. My name is Pilar Chayachinda. I'm a program officer of our, Region 5 team in Roxana, and also First 5 LA for your participation in Best Start Antelope Valley. We cannot express how important it is, and really grateful for this team and your participation and your partnership, especially in the data work. Just to give you some update feedback, the data work that you've been doing in the last months have really been a great example, and we're watching, and other organizations are watching on how data in Antelope Valley. So one of the things that was identified, I think that you as a partnership identified earlier on, is the lack of data in Antelope Valley. And when I say data, not just the numbers, but like information on what's happening in the community from the conversations. So in the past few months, I've been attending the meetings and really like interested in what's coming up. And it's like, we kind of knew some of them, but it was another thing to see them, you know, in infographics on paper. And I think, you know, other agencies are looking at the numbers as well. And really, this is like, oh, this is like hard, like real. This is what the community is saying. And then even like reflecting in the past few months in the conversations that you've been having. So I've been joining like some small groups, eavesdropping here and there. The depth of your conversation and how you're understanding and talking about data is so different, like from the beginning. If I could just say that, like before, I think you're looking at the numbers, but now just listening in, like really hearing that, you know, what the data means to you and how you're seeing like the impact of that. And then also thinking about, you know, what you would like to see happen at this point. So I think this is the last data mat meeting for Best Start AV. And I think the next step is like really out, you know, talking about the priorities. We hope that you'll continue to participate because this is so important. From my end, I just want to share you that these data mats that's been shared to me by Sylvia, I've been sharing it with other funders, with other agencies, because even in the funders group that I participate in, it's like, we don't know enough about Antelope Valley. We hear this, we have information data from county agencies, but seeing like this data mat, like collecting and kind of putting like a picture, a blurb, like a summary of what's happening has been really helpful. So funders have been reaching out, like, tell me more. So part of it is just like, I think what this data mats have done is an interest from other funders, other potential partners, county agencies to like learn more about the work. And I hope that, you will continue to participate, so that you will have the voice to drive the work, because this data is, from the different sources, but a lot of them also came from you. So like you're in this, and I just want to like assure you that it's not just for, we have this piece of paper, but that Best Start AV, your partnership is doing, is now you're going to go to the action thing. So it's not like for naught that this is really important and this is just a first step. So I really want to thank you for your participation. And I'm really looking forward to like hearing what happens. And I cannot even tell you how exciting this is, and how just like the excitement that even my colleagues from other regions and other funders have been talking about and kind of watching what's happening in this space. So I just want to thank you for that. Thank you.
Thank you. Okay, so they watching us. I always feel like somebody's watching me, but we are making some moves. And we're making some traction. So that's the great thing. And we want to continue on with that as we prepare for our CCAs and choosing, as Sylvia said, those two areas that we want to incorporate and move forward in. Before I go any further, Sylvia, is there anything else you want to add or say before I move on?
No, other than thank you for everybody, all the work that you've been doing, all the time that you've put into this. I promise you it'll pay off, because we're going to have some amazing projects that are going to come out of this. And basically what we continue to see is our amazing community who you've all been identified as leaders and experts in our community. So just thank you.
Awesome. All right, let's go to our next screen. All right, coming up, our stakeholders convening will be taking place on Tuesday, June 20th. You are invited to participate in that. Now, that's going to be via Zoom. It's online, so the Zoom link is there. You can go on and register and come on and be a part of that. It will not be hybrid. It's strictly going to be Zoom, but that will take place on June the 20th from 10 to 12. And we're going to be doing some more reviewing, because now the stakeholders will be seeing what you see each and every week. Well, we're going to just do some snippets of data mats. And we're going to show them what you have been dealing with and what you've been working through. And they're going to have a breakout session. So you are going to be a part of that presentation. All right. All right. Follow us. Woosah, follow us on Facebook, YouTube, Instagram, Linktree. You can scan us and get our Linktree, our Best Start QR code. You can scan that and be a part of that. Next slide. Listen, thank you. Thank you for participating. Thank you for your input. For those of you who are online, thank you for your input. We appreciate you taking time out of your busy schedule, your morning, to show up. You could be doing something else, but you're here with us